Okay, so this is a video that'll talk about the beginnings of CBD oil. And you might think, well, why is CBD oil on Cynthia Wine Divine? Well, what goes better together than CBD oil and wine? Plus, I'm a nurse, and I've noticed that with the crackdown on the narcotic industry, that a lot more people are turning towards the CBD oils. And I have had wonderful reactions from patients who have been taking it, telling me how it has helped their pain, even better than the Norcos or the Vicodins that they were taking before. So this is just an introduction to CBD oil, why it works. This is where you can find me, wine and CBD oil. I can be found at www.cynthiahealth.myctfocbd.com and then www.directsellers.com/Cynthia Wine Divine. So those are a couple of places where you might be able to find me if you're looking for me, okay? So, figures. Hold on. We'll get there sooner or later. Okay. So first of all, what is CBD oil? A lot of people, especially my older patients, get confused as to the marijuana aspect of it and talk about how they don't want to get high. Is it legal? Is it not legal? And what CBD oil actually is the cannabis plant has many different species, one being hemp, the other being marijuana. Well, the marijuana is what holds the THC, which is the high that you get from smoking it, eating it, or whatever. The hemp is a different variety of cannabis, which we actually use industrial hemp in a lot of textiles also. But this is where we get the CBD oil from, and it has very low levels of THC. Matter of fact, the legal limit of CBD oil is 0.3% THC. So you don't have to worry about getting high. So again, it's got less than 0.3% THC in the oil. It won't get you high. It will not show up in a urine drug test for all of you out there worried about work and the CBD oil. And why does it work? Your body initially has receptors, and they're cannabinoid receptors made specifically for CBD oil. Now, why it's taken this long for us to realize those receptors, I have no idea. But the cannabinoid receptors are in CB1 and CB2. There's also CB1 and CB2 together. And in the CB1 receptors, it's the central nervous system, which is your brain and your spinal cord. That is where we interpret pain. So that's why that works. It's also in your lungs, in your vascular system. So it brings down your cholesterol, your smooth muscles. It in the muscular system, gastrointestinal tract for nausea and vomiting, especially with patients with chemotherapy, and your reproductive organs. CB2 is present in the spleen, bones, and skin. I use it, talk about skin, I use it on my psoriasis. I have a couple of psoriasis plaque. It has worked amazing for. Then it is also, both of them are present in the immune system, the liver, bone marrow, and pancreas. So you can see that these cannabinoid receptors are throughout our body. Some things that CBD oil can help with is it can slow bacteria growth. So if you're having an infection, it reduces the blood sugars. It's an anti-diabetic. So I would never tell anyone to get completely off of their medications or their insulin, but maybe this can add to where you don't need to use as much. It reduces inflammation. It's an anti-inflammatory, which is why it works so well with pain. It reduces the risk of artery blockage, whether it's in the heart or in the carotid system. Seizures. The first thing it went through with Indiana was actually it was okayed for seizures because of how well it works. Indiana passed that law first before it passed that it could be used for everybody. There's some studies that show that it inhibits tumor and cancer cell growth. It can treat psoriasis, which is what I use it for, and it has worked extremely well. It can suppress muscle spasms, promotes bone growth, especially if you've had, let's say, a lumbar fusion or cervical fusion, and we need that bone growth to occur. It has been shown that it can promote the bone growth. It is a tranquilizing, it's an anti-anxiety medication. Again, we talked about pain as far as the anti-inflammatory, that's the way that it works. It can protect the nervous system, it's considered a neuroprotective, and it can reduce contractions in the abdomen for people who have maybe a colitis type of illness. So again, this is just an introduction into the main parts of the CBD oil. Like all supplements, it does matter where you get it from. I take very high quality supplements too because they do make a difference. The FDA does not regulate the supplement industry. So when you see something and has a percent in it, you really want to make sure it's coming from a company you can trust. What I use, which is CTFO, it is a third-party testing. It is made in the USA, so you want to consider using that. We have a health line. We have different oils. We have a 300, a 500, a 750, and a 1500 milligram, and we also have a lot of the creams. If you want to look at it closer, it's Cynthia, cbdhealth.myctfocbd.com, and you can get to it like so. What are you doing, Madison? And this is where you'll see you can talk a little bit more about what is CTFO, what our products are, and any information that you want. So if I can help you with anything, please leave a message on the YouTube channel, and we'll see you later. Bye-bye.